In our view, the environment is going to be significantly different than it has been historically for the last 20 to 30 years in healthcare. I would consider the last 20 or 30 years, since 1990 pretty much, the environment would be what we call a moderation era. It's an era where we had a lot of outsourcing, we had a lot of low inflation, and other than 2008, when we had the major housing crisis, it was very shallow recessions with moderate growth. In that world, healthcare grew up after the post in 1984, 1985, when the federal government gave us fixed rate DRGs. We grew up during this environment of fixed rate DRGs and the conversion of more commercial to Medicare as our populations aged in what I would call a moderate era, a relatively stable era where we had low inflation and we could get moderate cost increases from our commercial side, even though it was shrinking, and we could try to become cost effective in this environment with Medicare as it continuously reduces its payments to us. I think, and our company thinks, it's going to go back to what we call the more tumultuous era, is post 1940 something after World War II, and in up until 1990, where you had a lot more inflation spikes, you had a lot more spikes with recessions. And in that more volatile environment, we are really concerned about the cost structure and the revenue structure of healthcare and how it's misaligned to this new environment. And so when you start looking at that misalignment and you realize that you're going to not easily get through high inflationary spikes, you're not going to get through challenges with our supply chain that are now starting to pop up. We're seeing that we have cybersecurity risks that we never had before. Even in the tumultuous era of 1945 to 1990, they didn't have cybersecurity events like we're going to be having today. And we have to be prepared for. We have the labor is becoming far more active than it was in the last 30 years. So we're seeing a lot more what we call business adversity risks on top of these potential inflationary and potential recessionary volatility. So in that environment, you got to really assess, what do you think your core competency is? And is that core competency going to be strong enough to get you through this new environment? And then the question after that is, are there potential merger opportunities, be it in the inpatient, outpatient side, that can help you get through this future state? And can you use your strength to take those acquisitions and make them valuable? And when you do that, you can then start to assess some of these questions that we're talking about today. So now, under that environment, when we look at a merger and acquisition opportunity, we're really looking at the merger opportunity from the perspective of, we know what our secret capability or sauce is, as we call it. We know what value we can bring. Does this organization we're talking to add to it? Does it have some additional elements that we need to further develop ourselves? Or is it an environment or an organization that needs what we have, and we can illustrate that we have that value we could bring to them, and we can go and make something better than what they currently have? So we look at organizations from that perspective, and I think we're starting to think beyond just what's accretive to our local market and saying, do you jump into another market if that market has an ability for you to achieve your strategic goals? And you're starting to see that nationally a little bit more, where some systems are not just thinking contiguously to their existing market. They might jump to a whole nother state and look at another state. And so I believe in the environment that we're looking at, we are very selective in our acquisition opportunities, and we are very clear on what we could bring to the table when we look and talk to a partner.